Hello, I'm Dr. Mary Ng, abdominal organ transplant with U of L Health. I really don't have a good answer why I became a doctor. I had some medical illness when I was a child, but I don't know if that really influenced why I became a physician. My cousins were pharmacists, and I thought it was interesting, but I wanted something maybe a little bit different. So I kind of already knew when I entered high school that I was going to pursue something in a medical career. I am actually an abdominal organ transplant surgeon. So what I do is abdominal organ transplantation, meaning liver transplant, kidney transplant, and pancreas transplant. I tend to do more kidney transplantation, so I tend to see people who are approaching the need for dialysis or those who are already on dialysis. So by doing a kidney transplant, these people can avoid needing dialysis, or they can actually come off dialysis altogether. The other organ I transplant is pancreas transplant, which is a little more unusual. But these are for people who are diabetic needing insulin. Diabetes can be controlled with insulin, but there's still complications from diabetes. By giving them a transplant, they won't need insulin anymore. Of course, they're trading in the need for insulin for now the need for anti-rejection medicine. But overall, their lifetime or their outcome overall is still better if they could get a transplant. There's definitely not a lot of transplant surgeons in the country. So just being a transplant surgeon does make us a little more unique. And very few centers in the country actually do transplant. But maybe even more unusual is pancreas transplant is even more rare. When it comes to patient care, the patient is always first. I always tell my residents when we walk into the operating room that the guest of honor really is the patient. It's not the surgeon or anesthesia or anyone else really. But we should all try work hard to make sure the patient is cared for as best as we can. I spend a lot of time at work, but most recently I did adopt a shelter dog. So now I split my time between work and taking care of the dog.